Okay. Well, hello, everybody. We're going to start today's webinar, and I want to welcome you. We all know how enormously busy everyone is at this point in time, and so we really appreciate you taking the time out to join us for the latest in our special topic series presented by the Domestic Violence Housing Technical Assistance Consortium. I'm Chris Billhart, and I am with NASH, the National Alliance for Safe Housing, one of the consortium partners. Sharing moderation duties today will be Debbie Fox from the National Network to End Domestic Violence. And we've been presenting a series every week on Thursday. And today's topic is from shelter model to mobile advocacy, which sometimes becomes virtual advocacy or some combination thereof. We've got a wonderful slate of presenters today, and we'll be introducing them shortly. Okay, as we get into today's topic, we want to preface it with some really important information that I think needs to kind of be foundational for all of our efforts. We've known for some time how underlying structural racism, which persists in our country, manifests in the incidence of homelessness, with huge racial disparities showing up in the numbers of people who experience homelessness. As you can see, 78% of people experiencing homelessness are people of color in the study that we've got up on the slide through Spark, with huge overrepresentation, particularly among Black people, Hispanic people, and Native American people. So we also see high rates of domestic and sexual violence as a thread across all of those groups as we look at folks who have experienced homelessness. And now we have COVID, and the way that COVID-19 is manifesting is really underlining this stark reality in the way that it is showing up in our country. And we know that Black Americans are dying at a much higher rate than the rate for white folks. And, you know, it's something that is, you know, again, another manifestation of many of the underlying disparities that exist and that show up in the ways that people have access or don't to health care and have underlying health conditions that may predispose them. We also know that there's a very high incidence among Native Americans and on tribal lands, but there are ways that kind of gets erased from what we look at because the data sets that many states are maintaining classify Native Americans as other. So it's been very difficult to see that showing up in the way that we're tracking how this disease is manifesting. We also know that racial residential segregation is a fundamental cause of health disparities. So of course that is playing into this incidence. We also know that communities of color disproportionately live in neighborhoods that don't have as much access to grocery stores, medical facilities, due to that historical racial discrimination, redlining practices, and housing policies that are still manifesting in the way that people can be housed. And people of color living in federally assisted housing often are in segregated neighborhoods and have fewer resources to reach to. So we know that all of these things are showing up in the way that COVID is showing up. When we think about the crowded conditions that many people live in, staying at home is maybe not as safe as it is for folks that are living in areas where they have much more access to resources and space. We also know that those challenges are very exacerbated for people of color that are living in rural communities. and again, being in areas where it's very under-resourced and difficult to access those services and support. So as we, in all of our approaches, our partnerships, and our strategies during the crisis, as well as how we move forward as we crawl out from under this crisis, we all need to keep those really foundational realities in mind going forward. Okay, having said that, I'm going to step back and introduce our first presenter today. Maria Williams is the senior housing specialist at the Pennsylvania Coalition Against Domestic Violence. And today's webinar, I should have mentioned earlier, we're really going to be trying to spotlight the responses that rural areas are mobilizing during COVID. And the state of Pennsylvania, the Commonwealth of Pennsylvania, has huge geographic rural areas. And Maria Williams is going to check in with us about what she's seeing in Pennsylvania. Maria?
Thanks, Chris, and thanks so much for the curiosity about what's happening in Pennsylvania. I think that there's a lot that we can offer that other states can learn from, and I also know that the inverse is true, that mobile advocacy looks different everywhere, and that the more that we communicate about how mobile advocacy is working in the field, the more success we'll have with survivors, the more we'll be able to access survivors during the lockdowns and the shutdowns that many of us are experiencing. And I think that we have the opportunity to learn a lot from each other. So I'm sharing a map here with you of the Pennsylvania balance of state. We have two COCs in the balance of state, the eastern and the western. It is incredibly rural. There are a few larger, more populated areas in the state, or in the balance of state, but mostly it's incredibly rural. In fact, we have some providers that really think that there may be more moose and cattle in some of the northern parts of the state than there are people. So that's the level of rural that we're talking about. The other thing that's interesting is if you look in, on the eastern side of this map in the Pocono region, a lot of the Poconos sort of function as a suburb of New York City. So it's interesting how incredibly diverse this area of the state is, and all considered rural, but very diverse within that. So mobile advocacy has been something that the providers in the balance of state have practiced for a long time. Those of you that do rural advocacy work, I really think that you all were the first ones to do mobile advocacy because there was no option. If you are working in a county or an area where you have a large area to cover, you of course are not going to expect survivors to come to you. That's not possible. There's no public transportation in many rural areas. It's unaffordable for survivors to get to you, etc. So you've made that a normal practice in domestic violence work. I think that when we get really centered in the shelter model is oftentimes when mobile advocacy sort of goes out the window. And so when we're talking about mobile advocacy, what we're talking about is the idea that the burden of transportation and of meeting is actually resting on the advocate rather than on the survivor. So a lot of folks talk about the idea of meeting both literally and figuratively where the survivor is. So both in the survivor's home, if that's what they identify is best for them, or in an agreed upon space that works well for the survivor, but it's really up to the survivor how that works. Again, rural advocates have been doing this work for a long time. What's been interesting, though, is that a lot of mobile advocacy actually depends on the advocate meeting the survivor in person. that has been almost impossible during COVID-19, but there are some exceptions to that, and we'll talk about those exceptions. So where rural programs have really struggled is to have the ability to use technology to meet survivors in ways that we hadn't thought about before, we hadn't planned for, and potentially we hadn't budgeted. When I've been supporting the programs around the state with moving toward a mobile advocacy model, I've heard responses that are both, we've been practicing mobile advocacy forever. Now the only problem is adding technical support to it. So making sure that advocates have cell phones and laptops, and making sure that there's even cell phone coverage in the areas that the advocates are in. These sorts of things are the challenges. And then I've heard from other programs that mobile advocacy absolutely isn't necessary, that it actually is essential for domestic violence organizations to be open right now and to be seeing people. And in the area that on the map where you can see it's called the Northern Tier, we see this a lot in particular. The cases of COVID-19 in the Northern Tier are very few for the most part, particularly in the northernmost part of the state. And programs there have stayed open and have seen survivors, have survivors coming in. It's business as usual. And what they've identified is they too are essential workers, which we, have been saying to advocates since this all started, is that, we talk about emergency responders often, and that you all are part of the emergency response. And it's your responsibility to do what's best both for the advocates in your community and for your organization and what your organization needs and can support. So some of these programs have stayed open and have kept moving through, and it's working for them. So I think that rural programs are really, really talented at that sort of identification of we're going to really work with what the survivors in our area need and do what's best for them. So one of the things that has worked for the quick pivot to technology support that many mobile advocates have needed is to use systems that already exist, but place different supports within those systems. So we have some programs that are have given their advocates an allowance for technology. So maybe that's paying for some of their internet or paying for some of their cell phone, and they're using their own internet and cell phone to interact with survivors. But they've decided to download Google Voice, for example. That's one of the things that I've listed here, to give the advocate a phone number that is not associated with their own personal cell phone. Google Voice is free, and it is as reliable as any other phone service is, and works well if you're in a pinch. If your agency hasn't prepared for advocates to have mobile phones, we know that most folks have mobile phones now, at least that are working for our programs. And adding Google Voice is a great way to support them in making phone calls. There's also a new program that Google is running. I think it's new. I'm not the best, the most technologically savvy person, so I talk about these, and Toby obviously is going to be able to answer far more of these questions and recommendations, but a lot of these recommendations are taken from the work that NNEDV has done. There's a program now called Google Duo, which does both voice and video conferencing. There are a variety of chat options too, and NNEDV has great resources within SafetyNet that talk about those chat options. Google Hangouts is a great one too for video conferencing. They also offer a chat option. But what our programs are really seeing is that Doxy.me is the program that they want to use for video conferencing. And folks have been able to download that and use that and meet with survivors quickly. One of the cool things that's come out of this too is looking at how support groups could be done virtually. And we have programs that are using Doxy.me for support groups. what they're realizing is this actually really lessens the burden of travel on survivors, and they may continue to do that. This is all, of course, done with the idea that survivors are signing releases, understanding that they accept the potential confidentiality risks that exist with using technology. But we never want confidentiality to get in the way of having survivors have the services that they're identifying that they need. So just because we have concerns, it's important to express those concerns. But if survivors are consenting to it and understanding and agreeing, it's important that we can really follow through with those services that they're identifying that they need. Also, if you all are using other tech platforms, I think Jenny just mentioned this in the chat, that are working, please let us know, because we would love to have more options in this and be able to talk about what's working in other places in the country. But SafetyNet has great examples also. So, in the height of all of this crisis, there's been a lot of learning, and that's the important thing that we can take forward as a state. And the things that we've really learned is that virtual advocacy can work, but we need the right supports with it. It's important to make sure that you have technology options built into your budget. And if you don't have that, doing budget modifications with funders is essential. Negotiation with funders is essential, bottom line, that we know what survivors need, and being willing to have funders also meet that need and really talk about what it is rather than following where their funding is saying we go is really important. That often takes long time relationship building with funders, but now is the time to really talk about what's needed, because funders are willing to respond in a way that I have not seen previously. We've also learned that facilities aren't always needed, that sheltering can look a whole lot of different ways. Folks are actively using hotels here in rural areas, even if that hotel is 20 or 30 minutes away from where their office would typically be located, and that's working well. So if facilities and space within facilities can often cause survivors to not get their needs met. And so not letting those space restrictions stop sheltering and other activities from happening has been a really important learning. And then also offering different options for hotline and support groups increase access for survivors. I already mentioned the lack of a need for traveling. If a survivor needs to come to support group and it's a stressful trip for them to make, whether that's on public transportation or even in their own car, it's great to be able to offer an online option as part of your offerings. And again, like, we know that the domestic violence housing first work that we're engaging in is all about offering options to survivors. So we're just not formulaically saying that this is what will work and this is what we're going to do. So tech has really, I think, amplified the idea that we can offer options that we never even thought possible, and that some of those are working well. The other thing that programs here in Pennsylvania have seen is that chat options for hotline is also a really great thing to have. It's much easier to be able to have survivors chat than talk on the phone while we're in quarantine. And so that's been something that's developed that they're going to carry forward also. So with that, I'm going to introduce you to Tara Day Ulrich. And Tara is the program director at a fabulous program in central Pennsylvania called Transitions of PA. And she's going to tell you a little bit how mobile advocacy has worked at Transitions.
Hi, everyone. As Maria said, my name is Tara Day Ulrich. I am the program director at Transitions of PA, and we are a comprehensive victim service center in central PA. We actually cover 3 counties in the central part of the state, and that's Union, Snyder, and Northumberland County. We're about an hour north of Harrisburg. And we run the gamut from being having a few of those smaller cities, like Maria mentioned. We have a couple of towns that are primarily college towns. We have very rural communities. We have Amish communities, and we also have a large swath of what was the coal region in central Pennsylvania, which since kind of like coal going by the wayside has become very lower socioeconomic and has a lot of poverty and struggles there. We have been in existence since 1976, so we've been around for quite a while. We've always covered the same service area. So for us, mobile advocacy was just always what we did because we had to. The area that we live in, because of it being so rural, there is no public transportation at all. Even with Uber and Lyft and things like that, I think when college is in session, there's like one Uber driver in one of our towns, but he doesn't drive very often. And we have one taxi company that serves the entire 3-county region. So transportation options have always been really limited for our clients, and we have always had to be creative about how we're getting their needs met. And we really kind of started doing that by partnering with local agencies such as libraries, our local community action agencies, our county assistance offices, United Ways, to try to see if they could designate some office space to us where we could meet with clients, where we could either do counseling sessions or talk through legal advocacy or just meet one-on-one. The other thing that was always very crucial for us was advocates having flexible hours to be able to meet outside of business hours. So we always said, typically your job is from 8 to 4, but, you might have to work one day from 10 to 6 to be able to meet a client's needs. So we are always asked our staff to be very flexible in that regard. In 2016, we actually received a rapid rehousing grant through the Eastern PA COC to provide rapid rehousing services to survivors, which meant now we had to incorporate housing case management into our mobile advocacy. And it really wasn't that bad, but we actually learned that we could be a lot more creative than we ever thought about with mobile advocacy. So we began offering home visits when clients were agreeable to that, or when staff, of course, felt safe in doing that. We also allowed for more public visits with clients who had special needs. So when I was working in our housing department, I had a client who had 2 children under the age of 5, and getting them to sit in an office was next to impossible. So we would meet at a local park. She and I would do our housing case management. The kids would play. Everything was great. So really talking through the client or with the survivor about what works for them and what are their needs, and making sure they understand if we are meeting in a public place, there's always that kind of chance that someone might see us. And so what do you want me to say if that's the situation? Or, someone might overhear. So do you want to keep our conversations very limited to like budgeting or something like that? So everything was going great with our mobile advocacy. We also had 2 safe houses in 2 of our counties, and the safe houses really they weren't so much a shelter model where everybody shared rooms and things like that. They literally are 2 very large homes. So we can usually keep in each of the homes around 3 to 5 families, depending on the size. One of the houses has a maximum of 15 people total. The other has a maximum of 13 people total. So they weren't very large, but we were finding that we were always full. And we did start utilizing a local hotel for those times when we were full. And then we also had an incident about a year ago where we had a fire in one of our houses. So while we were doing renovations, we had to utilize hotels there. So we were already kind of using hotels, but very limited when COVID happened. So when COVID hit, we really started going, well, now we have to really be 100% remote with most of our things. The first thing that we were able to do with our hotline was we developed a hotline schedule. So typically we had a set designated staff who that was their job, was to do hotline and cover it 24/7. We actually went to a model where instead we assign the hotline to different people throughout the day, and we simply forward the lines to their cell phone, be that an agency cell phone or their personal cell phone. And we prioritize those advocates who were struggling to fill hours. So, for example, our child advocate wasn't able to do as much one-on-one counseling sessions with children. So we have her filling in for Hotline where she can. And we moved to 100% using hotels for all of our emergency shelter. We looked at our screening tool that we typically used, and the essence that we wanted to keep more than anything else was to make sure that we were still screening in. And just because we were using hotels that we know are more expensive, and it's not as, it doesn't feel as good or as normal for a lot of people as our safe house always did, but we wanted to make sure that we were screening in and not screening people out. So really, we were just very upfront with people that we want to bring you in. We want to make sure that you're safe, but this is what our services look like now. You're not going to have that 24/7, I'm having some anxiety in the middle of the night, I'm going to go down and talk to staff like you normally would. So just really being upfront with clients about what the hotel stays look like. And we still prioritize those individuals who have immediate safety needs as far as coming into Safe House. What we try not to do is to, deter people from coming in. And it's been working really well. If we do the intake paperwork with people over the phone, do the explanation of our services, and kind of ask them what their needs are. If they have needs for food or clothing, and they have transportation, we will often try to drop them off gift cards. That way they can go and get whatever it is that they want or need, and what'll work for them. If they don't have transportation or they're unable to do that, then typically what we do is we'll have the survivor make a list, and a staff will do the shopping and then drop it off in the lobby of the hotel for them. We also get our housing team involved right away. When people were coming into Safe House pre-COVID, we would generally give them a few days or a week to kind of get acclimated before we started trying to see what their housing needs are. But we've really found that getting them started right away, even though it may not always seem as trauma informed as the way that we used to do things, is really key to make sure that we are getting them into a permanent housing situation. And we've been very fortunate that our housing team has been able to get quite a few people either housed in a new unit or help them to find other housing options that might work for them. When our counties started opening up a little bit more, and kind of in Pennsylvania, our governor has instituted a red, yellow, green phase. So a lot of our counties were moving into the yellow phase. We took a look at what we were doing, and we made the decision that if someone is in the hotel for 2 weeks and they've been properly quarantining, we know there's very little risk of exposure, and that they're not having any symptoms. On a case-by-case basis, we may move them into our safe house at that point. We've had some individuals who have had some developmental disorders and or mental health needs that really make it difficult for them to be alone in a hotel room. And so being in a more home environment makes things easier for them. So we're working into transitioning into doing that and just really taking things case by case in that regard. We've also, as Maria referenced, started using telephone and virtual conferencing for counseling and housing case management, and that has gone so much better than we ever thought that it would. We really thought that people were not going to take to that, but what we found is that a lot of survivors really like that. They really like still being able to be in their home, not having to have the transportation woes that they had as far as coming into the office, and they really enjoy just having the virtual sessions. And we've had some survivors even ask if they can continue doing those once that's over. Our legal advocates worked very closely with the courts to develop a process to still be able to do legal advocacy with clients. So our process, we worked with the prothonotarians to work out how we can basically just meet the client outside of the courthouse to have them sign papers, and then the judges do a video call with a survivor to do the hearing for their protection from abuse order, and really limiting the amount of exposure that staff has either with the courthouse or with the client though. In doing all of this, we've really found, like Maria said, technology is 100% the key to all of this. We were very fortunate that in the 2 years before COVID happened, we had used a lot of the VOCA competitive groups to be able to upgrade our technology and make sure that all staff had laptops and were able to be more mobile than they had been. We recently, within the last year, we had got most of the staff an agency cell phone, especially those who were expected to travel more throughout the 3-county region. Since COVID, we have used Google Voice for those people who did not already have an agency cell phone. And we were able to do some budget modifications, like Maria described, to be able to enhance our technology. So because we do have some staff who live so rurally, even if they did have internet, it's not the greatest internet because of where they live. So we were able to help them by purchasing hotspots. And as Maria said about offering a technology stipend, we were able to offer each employee a technology stipend that allowed some of our staff to be able to upgrade their internet services, so they were able to utilize to do more things remotely. As far as challenges that we faced, transportation continues to be a challenge for us, as I said, because really the only type of transportation we can ask for outside is the one taxi company, and we've been very lucky that they've continued to run and are very good about meeting our needs. And it really just has been our advocates being very creative to try to problem solve, to find other resources. Sometimes if it's a police officer who's responding to an incident, oftentimes they in the past would not want to provide transportation, but now they're being a little bit more lenient and sometimes will provide transportation into the hotel for clients. And just instituting a policy with precautions for staff if it comes down to it, and the only thing a staff can do is to require transportation. We did make sure that every staff person had a supply of masks, gloves, cleaning supplies that they could take with them. So in case they did have to provide transportation to someone, they could make sure to have enough masks to have themselves, the parent, and or if there were children with them. The other big challenge to this, especially when it comes to those clients who are seeking emergency shelter, is keeping them engaged because we're not seeing them as much as we used to, and we're not getting to know them perhaps as well as we would when they're in safe house with us all the time. We have heard that a lot of the clients miss the engagement from staff and other residents. I'm sure those of you who have worked in programs know that, you know, when you have a group of individuals in your emergency shelter, they kind of build like a community, and a lot of people, it seems like they miss that, especially we have had some clients who've been with us in the past and they have noticed the change. And then just keeping everyone organized and on the same page in terms of staff and what's going on with people. You know, whenever we were seeing each other every single day, it was much easier to communicate about what was going on with Jane Doe in the shelter. But now we're kind of spread out, and so keeping everything straight is definitely a challenge. So just making sure that you have point people who they know that, okay, we brought this survivor into the hotel, so you are her point person. It's your responsibility to make sure that you are checking in with them at least once a day, that you're bringing anything back to the group and making sure that those things are followed up on. I am very fortunate that my residential services coordinator, Crystal, is an amazingly organized person and is able to keep all of that straight because I am not that And so get yourself a crystal if you can. But if not, just assigning those point people and making sure that everyone stays communicating and stays on the same page. And it may seem like you're over communicating, but I promise you, you're not. And as far as things that we are going to keep moving forward is, number one, like I said, the virtual counseling sessions. We have had some clients who have really thrived. We have even had, our therapists and our counselors say how much that they've been surprised that clients are enjoying it and how much that they feel like it's almost, for some people, easier to get them to talk and work through things than it is in person. And I really feel that we're going to utilize the hotels more. In the past, hotel had really been kind of a last resort option if we didn't have space in Safe House, or there was some reason why we couldn't bring them into Safe House. But for as many people that they come into our Safe House and they do really well, there are always those survivors who just do not do well with community living. They just are not suited for that. And, a lot of people, they try and it just doesn't work out. And we know with them coming in that they're not suited for community living, but we bring them in anyway. And sometimes it blows up in everybody's face, and it just ends badly for everybody. But knowing that we could provide the same level of support, advocacy, and service to someone at a hotel and have it work out better was a real eye-opener for some things. So I really feel like moving forward, we'll continue to evaluate whether or not a hotel or a Safe House would be better for the survivor, and just using that more often. I mentioned throughout here that some of the funding we've used to be able to accomplish this has been various VOCA funds. They have really allowed us to be more flexible with our funding since COVID-19, and to submit budget modifications that have allowed us to put more money into emergency food and housing, more money into technology and travel expenses and things like that. And then our rapid rehousing grants have been really key to making sure that we have funding to get people moving on rapid and to enhance our technology and travel there. And we've also looked locally to local foundations and our local United Way for additional funds in helping out with those things that our grants wouldn't typically cover. So if it is, now we do have prevention money, but up until recently we did not. So, maybe it's a situation where the survivor has gotten their abuser out of the home, but now it's tough to make rent. So working with local agencies to help them fill in those gaps has been really key as well. And that was all I had. Now I'll turn it back over to Chris.
Tara, thank you so much. That was just chock full of really helpful information. And Maria, you as well, in giving us a sweep of the state. I want to go ahead and introduce our next presenter. And Toby Schulruff from the Safety Net Project at the National Network to End Domestic Violence is going to give just a tantalizing appetizer about this topic, because it's a big one. And she'll be ending with providing some resources. So we just wanted to have her address, do an overview of some of the tech safety issues around doing virtual advocacy. Toby?
Thank you, Chris, and thank you everyone for joining on today. I really loved hearing the specific stories of how technology has been used in Pennsylvania, and particularly rural Pennsylvania. So thank you, Tara, so much for sharing the stories from your area. I just want to touch back on something that the call opened with, which is talking about the disparity and disproportionate experience of DV and homelessness, and to really tie that to technology, because we know that for folks who are disproportionately experiencing DV and homelessness are also folks who are more likely to not have access to technology in the same way. Within the technology world, they talk about this either as the digital divide, or in efforts to address that, they talk about digital equity. And so lack of access to technology can look like a lack of access to broadband or Wi-Fi, which is really important as you're considering what technologies to offer to connect with survivors. But that can also be lack of access to devices, newer phones, computers, even email can be challenging, particularly now during the pandemic, because for folks who were getting by without having internet access at home, or who were maybe making use of public Wi-Fi hotspots, or who were using email accounts at their schools or libraries, that those aren't options right now. And so it has exacerbated that lack of access to technology. And at the same time, we know that technology is increasingly required to be able to apply for jobs, benefits, housing. And just another piece to add on there, that online data about each of us and about survivors can include credit, court cases, even social media posts, and those things are used by employers and landlords to pre-screen people before considering their applications. So all of those are factors which have been made even bigger by the pandemic, and which create added barriers and added places for us to be able to work with survivors to better support them. So in considering how we're using technology in our work, it's important to consider two pieces. One of those is support and access, right? We should meet survivors where they are. And right now, that's often through technology. I heard both folks, both Maria and Tara from Pennsylvania, talking about how even though some programs may have adopted technology just because of the pandemic, that they're finding that survivors are really eager to adopt some of that in some cases, right? And so it's important that we show up where survivors are and provide them with ways of communicating with us that matter to them, that are accessible to them. And so that both means, like Maria was saying, if someone reaches out to you by, say, text message, that isn't really the most secure way to communicate. But if that's the only way a survivor is going to reach out to you, you should absolutely keep communicating with them, right? You can provide information so they understand their risks and are making an informed choice. You can provide options to more secure ways of communicating. But ultimately, if a survivor says, I want to keep texting with you, you keep texting with them, right? So we really do want to meet survivors where they're at. On the other side of that, when we're putting things on our website to say, hey, you can talk with us in this way, then we want to choose the most secure options that we can, and those are often options that are also going to help us to better meet our confidentiality obligations. So an example there is to use something like web chat instead of text, because web chat can pop up in a browser window and then the conversation disappears once it's done. Unlike, say, a text message where there's a whole word-by-word transcript of the entire conversation that's kept on the survivor's phone, the advocate's phone, or whatever way you're using to communicate with someone by text. So those are just examples. But we also want the tools that we offer to not have a lot of a tech barrier, right? And so that can come up with video, because video feels so much more personal, right? You can see me, you can hear me, I get those visual and audio cues, and that's great. But especially if someone doesn't have access to broadband internet or a strong data plan on their phone or data access, especially, which is often true in rural areas and frontier areas, then that's a barrier to access, right? If our conversation keeps freezing or disconnecting, then maybe something like chat or text is going to be a better option for that survivor than video. And it's not just survivors' access to technology, right? As Tara was talking about, and as Maria mentioned as well, advocates don't always have the technology, right? So it's great when we, as organizations, can work with funders and work with our budgets to provide that technology for advocates. And that includes devices themselves, like phones, but also includes internet access, as was mentioned, whether that's a Wi-Fi hotspot, a mobile Wi-Fi hotspot that someone can bring home, or a stipend to be able to increase their broadband access at home. So those were all great options that Tara and Maria were mentioning. I do want to talk about privacy and safety briefly. So there are so many details around each company and each tool, and that's the sort of thing that I can't cover today in the short time with you. But I do want to just give you some guiding principles to consider. One is that the more options that a tool has for anonymous use, the better. We don't think that survivors should have to create accounts or give over personal information like email address, phone number, geographic coordinates in their location device, the location part of their device. They should be able to be anonymous just like they are on our hotlines, if not even more so. The tools that we're using shouldn't leave traces on a survivor's device or in their accounts. So, like I said earlier, text leaves a word-by-word transcript of the conversation. So does email. And often, even after you delete it, it might still be found either within a cloud account or in the deleted items folder. So those are things that are like digital traces. Again, if that's the only way a survivor is going to communicate with you, meet them where they are. But more secure, more anonymous options that don't leave traces include video or chat by link or through a browser window. So just keep those things in mind. So there's a risk that someone else might hear the conversation or see a transcript of the conversation. Those are important things to guard against. Another piece is, with text or chat, there's a risk that the person you think you're speaking to isn't actually the survivor, impersonation. So in that case, you can do things like develop code words or code phrases with someone if you're working with them over time. And then in terms of program confidentiality, this is a place where there's a lot of confusion. So when a survivor contacts your 800 phone line, they're giving their phone number to that phone company. And that's not a confidentiality issue because the survivor is choosing to share their information in order to reach out to your services. Confidentiality applies when we as an organization are holding on to survivor information and how we protect that. So that means not giving more information to a technology provider than they would have anyway, and deleting as much as we can so we have, the less that you have, the less you have to protect, right? So you don't want to keep recordings or transcripts of calls or video calls or chat messages, for example. And you want to not be holding on to people's phone numbers, email addresses, IP addresses, all of those things that are personally identifying. Don't collect more information than you would if you were having a phone call with someone or if you were meeting with them in person. That's just a general guideline. Earlier, folks were talking about some specific tools to check out, and I'll put these into the chat as well, or you can follow up with us by email, and my email address will go up there in a moment. Once I get finished talking, I'll put these into the chat. There are tools that are great that offer, some of them video and chat. Some also offer group video, so there's a variety of tools. They're Resource Connect. Again, I'll put these in the chat. Doxy.me, which was mentioned earlier. Groovio. I'm actually going to spell these out for the closed captioning. Doxy is DOXY.ME. Groovio is GRUV as in Victor, EO. Cyph, CYPH, and Jitsi, JITSI, and then also 10-digit communications. Again, I will put those in chat once I stop talking. Those are all tools that have a high level of options for anonymity, that have are designed for privacy and allow us to meet our confidentiality obligations more easily, and that provide low technology barriers to access. A very popular tool like Zoom has some problematic aspects when it comes to privacy issues, and they've been doing a lot of work to shift up their security, but it's beloved by folks who are in the deaf community and organizations in the deaf community. And so it has really high access for folks to be able to also bring in ASL interpretation and closed captioning. So know that access, unfortunately, and privacy are not always built into the same tool. Some other points that came up from Maria and Tara that I just really want to support are that it's important to plan for advocates' access to technology as well as survivors' access to technology. So other pieces in addition to what has already been mentioned are if you can provide some kind of IT support that's like tech support for your advocates, that's great. Helping them set up new accounts or run security checks on their devices or on their home Wi-Fi networks. We have some good plain language guides on our website that help folks to navigate simple steps that you don't have to be a geek to be able to put into place. We really encourage advocates to practice new technology together. So if there's a new chat tool that you're going to be using, have advocates try it out together before you launch it live with survivors. And we also encourage that even if folks are using their own personal devices, like a phone or a home computer, that they are using accounts that are managed by the program. So Google Voice was mentioned earlier, and there are ways to set up personal Google Voice numbers. That means having another number that you can give out and people can still reach you. But the program has no control over those accounts. There are free nonprofit Google accounts. It's called Google Suites. And that is a way that a program can actually manage virtual numbers and a number of other features that Google has available. Now, I understand that the more private options cost an additional amount, which is true for Microsoft as well, but that's important for considering confidentiality obligations. And there's simpler options, too, for getting phone numbers to survivors. We have a whole new tip sheet on our website as well that covers some remote options for phones. That includes talking with your existing phone provider to find out what they can do for you, looking into internet-based phone, which is called VoIP, and then also looking at some other more fancy options that take more to implement. So our website has more information on that. I want to just close by saying that there's also some approaches in the conversations that we're having with survivors about using these new kinds of technology, and just give some quick tips on that. So it's important to talk to survivors about the risks each time. It can change over time. To plan for safety and privacy with survivors, to offer options for more secure or private ways to communicate, and to just keep in mind that for both survivors and advocates' accounts, that because our phones and our email and our text messages are all connected into the cloud, if we think we've gotten rid of information in one place, it might exist in another place. So just keeping that in mind if folks are like, oh, I'm going to delete my text messages from here so no one else can see them, to think about all the places that those messages might be to make sure that they're actually deleted. If we can, I guess I can flip to the next slide. We have our digital services toolkit at techsafety.org, and I just put that in the chat. And you can find lots of information specific to the pandemic and also for a longer planning process once you have more time and resources to think about it. And you are more than welcome to email our team with specific questions. I'm going to stop talking and I'm going to put some of those suggested tools into the chat.
Thank you so much, Toby. And hi, everybody. This is Debbie Fox, also with the National Network to End Domestic Violence and a part of the Rehousing and Technical Assistance Consortium. So I just want to thank Toby, Tara, and Maria so much for your really great information and super helpful advice and just all the different strategies and different innovative approaches that you all are taking to shifting models and working remotely and mobily. So there have been some excellent questions in the chat box, and as you can notice, it's 1:57, so on the East Coast, so we have only a few minutes. But people are welcome to stay on the call, and we can continue the conversation to make sure we get all the questions answered. But there have been some answered in the box. But I just wanted to ask our presenters a few questions around some of your changes on your approaches. I think, okay, Tara's answered this question, but just I want to make sure to say it in the space is, Lisa was asking, how do you approach hotels for space? And it looks like just simple outreach, and as advocates we're also great at doing this. It looks like calling the hotels and making those requests. And it looks like Brittany put in a link to, we had a webinar earlier in the series on working with hotels, and there was really great information from those programs about making deals and really trying to get some affordable options for your programs and housing options for survivors. And then there was also a question about when are people going to be able to move back into their safe houses, and so really helpful answer as well that it's really a combination of decisions of the CDC and what different counties or states are requiring in terms of best practices around physical and social distancing. So that's something to really think about with local officials and state governor requirements, as well as the various, sorry, I'm reading the questions as I'm answering, so I'll do one thing at a time. So what do you think, in terms of the presenters still on the call, what do you think you will carry forward post-COVID? I think I heard Tara mention that some of the survivors are requesting that they would still like to continue mobile services post-COVID. Can you talk about if that's something that you would continue post the pandemic, or any other approaches that you see are working really well that you'd like to carry forward as things shift?
So for me, I did talk about, we're definitely going to move forward with the technology and the virtual counseling sessions, because that has really just kind of opened our eyes to a whole new world. Another thing that we're looking at doing before this, in the school year before this, we had started a kind of like a group outreach. It was half education, half group counseling at a local community center that had an after-school program, and it was really directed towards teenagers. And they all kept saying, you know, I can't use my phone to call you guys, but I wish you guys had ways that I could text, or I could send you DMs, or just do chats. So that was something we kind of had on the back burner, but really this has allowed us to explore it more. So we're going to start looking into more of those options for people to be able to reach us in different ways. And also looking, as far as our education and prevention team, looking at ways that we can be more present online with our education and prevention programs. So, you know, it's anybody who's worked in that realm knows how difficult sometimes it is to get into schools and to be able to do like 5 sessions in a school. So having a way to be able to deliver those in an online format is really appealing to us.
Thank you. Is there anything you want to add, Toby or Maria?
I think that one of the things that I've heard from providers is, and this actually goes to Julie's question in the chat too, is that the traditional shelter model, for the most part, is going to have to change. And I think that, like, there's been all of this talk in the media about, like, you know, well, the new normal and what can we go back to and that sort of thing. And I think that, like, DV programs have really just hung on to their shelter models for longer than probably a lot of them need to. And shelter needs to be one of many options that we're offering. And I think that the programs in Pennsylvania have really begun to understand that and really, like, live into the DV Housing First model of, you know, can we get you into permanent housing, both now because that's going to be safer for you because you're going to be able to stay there long term, you have a lease in your name, etc., but also because it's going to be sanitary and you're going to be able to control your environment and have your life continue far more normally than if you're staying even in a shelter where social distancing and reduced census is taking place. So I think that's the other thing that I'm seeing.
Thank you. That's super helpful. Another question that I'm curious about as well. So we're hearing, from you all that there's been some positive shifts with the transition to mobile advocacy for a number of reasons and during COVID, but also curious, how are you as programs and as a state coalition helping staff navigate the transition from typical site-based advocacy to mobile advocacy? I think I heard you say earlier, Charlotte, that there was an advocate that really liked doing at-home support and advocacy services. So how have you helped navigate that, and do you see that also shifting as well for your staff and advocates?
Yes. I think there are some advocates who really do thrive. Well, I'm going to apologize for the dog outside that's causing a lot of things. But anyway, so there are some advocates who are really thriving about that, and there are others who are not doing well at all. Those who are thriving are being really communicative and are really outgoing. Those who are struggling, we've had to make some concessions with them and just really be more available to staff to really talk through any of their needs. I think I've talked to more staff that I don't normally see through this just to kind of check in with them and make sure that they're doing well and what can I do to help you than I ever did at the office. Like I had very little contact with our third shift staff, but now I feel like I talk to them at least 3 times a week, which has been really good. So I think just as administrators being available for staff, being responsive to what their needs are, and being really transparent about the fact that this is new to all of us, so none of us know what we're doing in this, and that we all have to learn. So, and just being open for that.
Thank you so much for that. Yeah, it's very humbling for all of us. We're all in it together and learning as we go, and there's lots of surprises and things that are unexpected that are happening as we shift and move through all these new processes as we shift how we do our work. And while we have you, we'll do one more question. I know a few people jumped off, but I think your expertise and all the work that you're doing in Pennsylvania in rural communities is super helpful. And we're curious, anything around anonymity in rural communities. So how are you addressing safety issues, and what's coming up as you're doing safety planning with survivors in rural communities during COVID?
So it's always kind of been a challenge for us in the rural communities because, we all live in these small towns and everybody knows everybody. And that's always been kind of a thing. We've been really, really fortunate that the hotels we've worked with understand and have been really willing to kind of take the lead from us on what confidentiality means and what that looks like. And, sure, we understand you want to have a driver's license in case your hotel room gets wrecked, but this is what that looks like for the survivor. So really just keeping those conversations going and making sure that we're checking in with the survivor at all times as far as if they are feeling safe, that because things are so up and down now, you may not have the same level of anonymity that you would have coming into the safe house, although that's kind of like a double-edged thing. I know Maria has always said, like, once you have one person stay in your safe house, it's not confidentially located anymore. But just having those conversations with clients, we really haven't had anybody who has really cited any huge concerns about anything that we're doing. We had one person who didn't want to go to one of our hotels that we were using because it was really outside of everything that she knew. So we cover 3 counties. This was in a totally different county. She would be away from her church family, and that was really important to her. So we had to kind of scramble to get another hotel in her area that was able to serve her. But really just being responsive to the clients and being open and making sure that they're aware of all the things that could happen.
One of the things that we've been supporting programs with as a coalition is making sure that they have the resources to be flexible in the ways that Tara's talking about. I think that that's one of the most important things that can be done right now, is that programs really say to a survivor, what is it that you need and how can we help you? Rather than this is what we do and this is how we'll do it. I think that we often define what anonymity looks like for a survivor, when truthfully it may be perfectly fine for you to be at the grocery store with that survivor, and if anybody sees them, you're that survivor's friend, and that's sort of the long and short of it. But it might have been a huge confidentiality risk for them to go into your community office, because literally everyone in the town knows what that community office is. So I think that those questions always have to be asked, and I think that it's certainly heightened now, but really it has to be defined by what the survivor believes is best for themselves.
Well, I think that's a great note to wrap up on, Maria and Tara, that just really always centering what survivors are needing and asking them versus doing the prescriptive of like, this is what we think needs to be done, and really having those conversations about what confidentiality and safety looks like for that specific survivor that you're working with. I think we got to most of the questions in the chat box, and I just want to be mindful of time, everyone's time today. I'm really thankful for all the great information and everyone for joining in on this webinar and joining the conversation. As everybody heard earlier, we're doing these weekly series every, what is it today, Thursday? So please join us next week, and we'll send out some more information and registration for that as well. And I just want to make sure to the other presenters and my co-moderator, Chris Billhart, if you have anything else to add as we wrap it up, I want to pass the baton on to others as well before we close officially.
No, thanks, Debbie. This is Chris. I just want to add my thanks for many of you were able to stay with us a little bit longer. It turned out that an hour was just not enough for this topic. And I know we, in some ways, just kind of scratched the surface as far as the conversations we need to be having. But it's a tough time to take time out to be on a computer webinar for more than an hour or so. So thank you so much for everything that you're out there doing for survivors. And we appreciate you plugging into the webinar today. We will be sending out the evaluation link. We hope that you'll give us some feedback, as well as let us know if there are additional things that you would like to see from us, or technical assistance that you think might benefit you. I want to thank all the presenters today, Toby, Maria, Tara. You were all just so full of wonderful information for folks, and we appreciate your time and expertise as well. So thanks, everybody, and hopefully you'll be able to attend future special topic webinars, and go out there and stay safe.
Thank you so much.